privileged to be here in East Texas for the last 20, and I'm really proud to be a member of this group of phenomenal doctors and a great forward-thinking hospital that gets this honor from IBM Watson as one of the top 50 cardiology programs, something not equaled in this area. But more important than that, I'm really grateful for the blessing of having families and patients from East Texas trust me to take care of their heart problems.
It's an amazing feeling. I grew up here in Longview, and makes me very proud to be able to come back and provide the top-tier cardiovascular care that our group is able to provide. This group has been doing it for decades. It started the cardiovascular program here in Longview, and we pride ourselves on the fact that we are on top of the latest, most technological, advanced cardiovascular care that we can provide.
You know, for us to receive that sort of recognition here in a smaller city means a lot. It means that we're delivering excellent care. We're doing procedures that are typically only done in like Dallas and Houston, and we've been able to do that here under the scrutiny of making sure that all of our procedures are done well and they're safe, and that the patients are happy and getting good care. And being able to accomplish all that in a small town is incredible.
This is a recognition for the great team effort that the whole hospital team, that includes the surgical team, the nursing team, and then the physicians put together, and for consistently to give comprehensive care over a period of time that has earned this recognition.
Longview Regional being named one of the top 50 hospitals for cardiovascular care in the nation for a third time it makes us very proud because I think it's the coronation of a combination of factors brought together by us and by everybody that works with us and the patients themselves.
Well, I think that it's quite an honor for me personally, as a part of a large cardiology practice, to be honored nationally.
So I think you should choose your hospital if your heart depends on it. I really do. Because you only have one heart, and at the end of the day, you need an experienced team that's going to be able to handle certain procedures, do them with the latest technology, and handle complications if they occur. So I think you need to be very cognizant of picking a hospital that is recognized. One important thing about the recognition is that this is a recognition that is not something that you can pay to receive. This is a recognition that was given to us by an anonymous group, and it's something we earned 3 years in a row. So this is not something you can sign up for, pay X amount of money, and get a recognition. This is independent of anything. So it's extremely important. So when you pick your hospital, make sure you pick a hospital that offers all the list of services and that is nationally recognized.
You know, I think what this award really speaks to is that it does matter where you go. It matters who your doctor is, and it matters that your doctor has access to wonderful nurses, to cutting-edge technology, and to caring people here close to home.
I think it's very rewarding for our community to have such excellent cardiovascular care that's provided here locally, that people are able to come to their home hospital and have care that is given in larger facilities in larger areas such as Dallas and Houston.
I think it's important to have a hospital where you know patients are going to receive quality care, whether it be from the physicians or the nurses or the rest of the staff in the hospital. And I have that kind of confidence at Longview Regional.
As a patient, it means that you are sitting here on a gold mine in your own hometown. You have access to providers, cardiovascular team that has been exceptionally trained.
I think that being here in our community, living among our patients, has a special bond, continuous care, not an interval care. And those things help us to know the patients, know their problems, know their families, and because we know them and have genuine concern for them and their well-being and have a long-term perspective of their health care.
I'm really proud of the fact that we have been able to provide some cutting-edge technology
I think what makes our group unique is that we have multiple team members that specialize in different procedures.
I think some of the most well-recognized procedures that we're doing here that others are not are transcatheter aortic valve replacement, and we've done a lot. Beating heart surgery is very important. Carotid stenting, one of the only places that offer that, as well as critical limb ischemia, taking care of patients that have reduced blood flows to their lower limbs, being able to salvage their limbs so that they can keep their legs. Pacemakers, we now also do leadless pacemakers, as well as the Watchman device. Those are some of the technologies that are offered here that not many other institutions offer. And lastly, abdominal aortic aneurysm repair and thoracic aortic aneurysm repair. We're able to do that here through small incisions in the groin without having to open up the whole chest.
Over the years, cardiologists in our practice have also adapted skills that has refined or advanced the care of cardiovascular disease in our community and in our hospital.
One of the reasons we are very passionate about cardiac care at Longview Regional Hospital is because we have certain visions that we give to our patients. Our vision is to have open heart surgery without giving any blood during surgery. Our vision is to do bypass surgery without stopping the heart. Our vision is to do valve surgeries, minimally invasive, without cutting the breastbone. We also have various protocols and cutting-edge technology that we use during surgery to minimize the damage done to the patients. With all of these visions in place, and when we are able to deliver it, we are able to put it into action, the benefit goes to the patient. So that's why any family member of mine, I would recommend them getting their care at Longview Regional Hospital.
What we're trying to do is get the best care for our patients in East Texas and provide that through the least invasive approach possible.
We are invested in our patients' future, so we don't just patch you up, do the procedure, and send you home. We actually treat you from start to finish and try to keep you healthy, and that includes, teaching our patients about their medications, teaching our patients about diet, lifestyle changes.
We're able to give the best of both worlds to the patient so that ultimately the end product is a less invasive procedure for our patients.
Our group of cardiologists is comprised of people with tremendous experience. They continue to innovate in their skills and in the new procedures that are coming out.
So here in Longview, we're offering all of the services that are typically done at bigger cities. One of the major reasons is we have a good core group. Our group of interventional cardiologists and electrophysiologists are able to do this because we trained for it. So we've all gone to very prestigious centers across the country that offer this, and we've gone through the expertise and the training to be able to offer it here.
It really means a lot to be able to work with a team of qualified professionals that you know are going to deliver top quality care. It gives me a lot of confidence whenever one of my partners has to take care of one of my patients, because I know that they're extremely professional, extremely qualified and skilled, and to be able to have that kind of quality care in Longview just reflects what we've tried to do ever since I came to Longview.
It means a lot to work with such an exceptional cardiovascular team. We're very privileged here in Longview.
It's a great honor to work with people that are passionate about cardiovascular care. I've been working at Longview Regional for 15 years, and 14 years of that was in the cath lab working with these cardiologists hand in hand and side by side, and it's a great honor to be able to ask them questions, to get feedback from them, and to hear that they have put a lot of their heart and time and energy into providing evidence-based practice and state-of-the-art care to the community.
It's very rewarding to work with a group of cardiologists and in a hospital who are proactive in adapting all the new technologies, bringing the latest to the patient care.
I think the achievement of excellence in cardiovascular care is a reflection of the harmony in the group.
every part of your body is important for the ultimate performance of life. I think every physician, every nurse, every employee contribute to the well-being of a patient. Particularly, I love my job because it gives me the effort and it gives me the opportunities to change the life of a person. People come pretty sick to our office, and when I see them with a new life, I thank God each day that I was given this opportunity at Long Beach Regional Hospital.
I have a passion for cardiology, and I chose to work in cardiology because the heart is the most important organ in the body, and without the heart, there is no life.
You know, cardiovascular disease is the #1 killer in the world and in America. And to be able to provide cardiovascular care to our community and to our patients is such an honor.
So for me, practicing cardiology has really been an adventure because it's a constantly changing field, and to be able to provide new and cutting-edge procedures to my patients has really been a great part of my practice.
I like cardiology because it is a very innovative branch of medicine. It's fast-paced with new technologies coming out on a very regular basis that have really impacted the outcome of patients. It has made a tremendous difference in cardiovascular health of patients. So it's very rewarding to see patients improve from their complex disease process and have a very fruitful life and good lifespan after these procedures are done.
I think that really what this honor means that if you do have a heart problem here in East Texas, there's a very good chance we can take care of it right here at home. We've got phenomenal doctors practicing state-of-the-art care in many different areas that you don't expect in a community hospital in East Texas.
I want to thank the entire team of nurses, technicians, surgical technicians, perfusionists, administrators, and my colleague cardiologists with the primary care for the exceptional work that they have put in for the last 10 years to achieve this award that has been consecutively given three consecutive years. So a big thank you to you all.
I want to congratulate the wonderful nursing staff, the forward-thinking administrators, and most of all my partners, the heart doctors and heart surgeons that have done the work for the last more than 30 years here in Longview, Texas, reflected in this award from IBM Watson, recognition on a national level right here in East Texas.
I would just like to say congratulations. You guys have put a lot of hard work, a lot of time, a lot of energy. These guys work long hours and very hard work in providing great evidence-based, state-of-the-art care to this community.
I'd like to congratulate our team for being recognized as top 50 in cardiovascular care in the nation. I believe it's well deserved. This program started with Dr. Rodney Henry and Charles Newkirk and has developed into a team who prides themselves on providing care to patients as if they were our own family members. We do it here in Longview. Patients don't have to travel to Tyler or Dallas or Houston to get better care. We provide it here at a superior level.
Congratulations on such a large accomplishment. To reach top 50 hospital in cardiovascular care in the nation is a huge accomplishment, and we should all be very proud of ourselves.
Well, keep up the good work, and we practice very ethically, and we have seen the results. They are extremely good outcomes, and I would be very proud to be with this group of cardiologists anytime.
I would tell my partners I'm so thankful for all their intellect, all their support. We all have our own niche. We all are master of this particular area, but together as a group, we're unbelievable. And so to work together to be able to do this is a great honor. I think most of my partners know that they're very intelligent. They push us. They tell us that we can do things, and we represent the group when we do this. And so at the end of the day, we're very proud of what they've been able to accomplish, and we really appreciate the support.
I would really congratulate our team for being the kind of program that is able to provide quality care that is recognized by IBM Watson for being a top 50 heart hospital. I think that's an incredible accomplishment, and one that is clearly well-deserved because of the quality of care that my partners provide.
And that's why
That's why.
Longview Regional
Longview Regional
Medical Center
is a top 50.
a top 50
Heart Hospital.